My name is Charlie Homer. I'm the chair of the Advisory Council on Public Health here in Brookline, and I'd like to talk to you a little about Medicaid and why it's so important. I'm a pediatrician, and people should know that Medicaid insures in Massachusetts at least 40% of children in the state. Across the country, it's closer to 50%. Medicaid also insures over half of all childbirth in the state. So that's critical both for the prenatal care, for everything around birth, and for a full year after birth. So as a pediatrician, there's nothing more important to child health and well-being than Medicaid. Tying that as well to some of our community health improvement initiatives, people don't realize that Medicaid does a lot of other things. So for example, when they were expanding Medicaid across the country just for children back in the 70s and 80s, they found that it not only helped improve child health outcomes, but it also improved the employment outcomes and the earnings for parents because they were able to take jobs that they wanted. They were able to move to places where they could get better jobs. So it actually improves not only the health of children, but also improves the economic well-being. Now, Medicaid doesn't only insure children and pregnant women. Medicaid also insures and provides most of the coverage for people who are in nursing homes and for adults with disabilities. So in fact, although only about a quarter, maybe a third of people on Medicaid are the elderly and people with disabilities, that's actually where most of the money goes. At least half, and in many states, 2/3 of the money actually goes to the insurance for the elderly and people who are disabled. Finally, there's one other group that's very important that was part of what some people call Romney Care and became Obamacare, came the Affordable Care Act, which was the expansion of Medicaid to cover low-income adults. Massachusetts was the first to do that, but it's done in about 40 of the 50 states in the United States. And what people have found when we've looked at states that expanded Medicaid for low-income adults and didn't, it makes a big difference in mortality and actually surviving. So Medicaid across the board is enormously important for everybody. Thank you so much.